Thanks, Deputy Speaker. I wish to raise a matter for the attention of the Minister for Mental Health, and the action I seek is for the Minister to urgently approve and fund 8 acute inpatient beds for adolescent mental health at Albury Wodonga Health. Now, there's a lot of people suffering, families throughout the district, but at present there are nada of these adolescent beds in the district. Now, these beds for adolescents who present with acute episodes of mental illness on the border. And, Deputy Speaker, let me give you one example. Mac, now that's not his real name, has homicidal ideations and has begun acting on those thoughts. He actually wants to murder somebody. He no longer goes to school. He requires hypervigilance from his parents, and they've exhausted all their leave entitlements. He no longer sees his psychiatrist in a face-to-face consults after he tried to strangle him. He recognises these thoughts but struggles when it comes to preventing acting on them. Now, during a recent episode, Mac, this teenager, presented at Albury Wodonga Health Emergency Department. Because there's no beds for his condition, and the mental health inpatient services we do have are for adults, not for those adolescents that require therapeutic treatment. But he was confined to a bed in emergency for 2 days. His mother had to sit by the bedside because there were no specialists available to supervise or treat her son for 2 days. Mac was transferred to Box Hill, which is an acute adolescent mental health facility, and which is from the border. It's our default option. But after 3 days, he was discharged with some pills and no therapeutic therapy. The impact on the family, friends, schools and communities is devastating. The Royal Commission into Mental Health was quite clear on the need for treatment to be close to home. It was also clear on the dire lack of acute inpatient beds for adolescent mental health in country Victoria. Now,
Canberra raised a matter for the Minister for Mental Health. And the issue that he raised was that the Minister urgently approve and fund 8 adolescent acute mental health beds at Albury Wodonga Health, and he outlined one particular fairly serious instance of an example that had been raised with him, and I'll make sure that the Minister receives that particular matter.